Please, first speaker, Dr. Anand Bagmer. Please.
Presbyopia using off-label presbyopic phakic diffractive intraocular lens. I don't have any financial interest in this. Recently, with the recent advances in cataract surgery has more or less become a refractive surgery. Even with the advances in the formerly biometric devices and other adjunct technologies, we still get many refractive post-operative surprises and unhappy patients. So to tackle them, we have many options like glasses, contact lenses, lens exchange surgery, corneal refractive surgery. Another option is piggyback lens where we place another IOL in a ciliary sulcus, and we have phakic IOLs, mostly used in a phakic patient to treat refractive errors. Use of these phakic IOLs in pseudophakic eyes with piggyback technique remains off-label use. In 2010, this Kojima first reported use of these phakic IOLs in pseudophakic eyes. There are another reports also. Notably, all these previous reports of legal phakic IOL was only used to correct post-operative distance residual error. But we used this presbyopic phakic IOL to correct post-cataract surgery residual pseudophakic presbyopia for the first time, represented as a unique aspect of this case. So we present a unique case where 48-year-old female patient, she was a beautician by profession, came with a history of undergoing cataract surgery elsewhere with the implantation of monofocal, extended monofocal PCIL implantation done in both eyes 1 year back. Post-operatively, she complained of difficulty in unaided near vision, which affected her fine near work. So according to her previous record, she was post-operatively unaided 6.6 for distance and N12 for near vision. For that, she was prescribed 1.75 presbyopic glasses for near work. She also gave a history of undergoing another surgery 6 months back in the left eye, where plus 2.5 diopter 3-piece foldable lens was implanted in the ciliary sulcus as a piggyback to make her myopic. So she came to it to have a solution for her right eye so that she could do her near work without glasses, without affecting her distance emetropic status. So on presentation, we examined her in visual acuity. In right eye, she was emetropic for distance and unaided J5 for near. She required plus 2 diopter for near vision. In left eye, she was unaided 6 setting for distance and improved with -2 spherical to 6.6. And she was J2 for near vision. Her intraocular pressures were normal in both eyes. On slit-lamp examination, she was pseudophakic in both eyes. And left eye, there was a 3-piece foldable intraocular lens that was in the sulcus put as a piggyback lens. There was a capsular fibrosis in both eyes. Her fundoscopy, corneal topography, and specular microscopy was normal. So after examining her thoroughly, we had 4 options to treat her residual presbyopia in right eye. That was IOL exchange. As capsule was fibrous, it was risky, so we decided to avoid it. Then presbyopic LASIK. Because it was slightly less predictable, we also decided to avoid it. Then piggyback presbyopic IOL, it was not available locally, and off-label presbyopic phakic IOL. So we decided to go with it. It was a surgery was uneventful. Under HPMC, we injected phakic IOL in anterior chamber. Then we tucked all the haptics under the iris. And then we removed HPMC thoroughly. So it was like a routine phakic IOL case. Post-operatively, we examined all the parameters on next day and every week for 4 weeks after surgery. At the follow, after 4 weeks surgery, operated eye was symmetric for distance, and that is 6 and near J1 for near. Her near vision was normal without need for reading glasses. Her slit lamp examination was normal, and anter-segment OCT showed good vaulting, that is 575 microns. So to conclude, our case demonstrates successful use of presbyopic IOL as a piggyback IOL technique. But it's a unique case. We want further evaluation as its utility, and it could become an alternate option for ophthalmologists to offer patients with suboptimal outcomes after cataract surgery. These are few references. Thank you.
So it was an IPCL, multifocal ICL. Okay.